Leonard. Thank you so much to our previous panel. Thank you all. Listen, from the beginning, I want to just be able to take a moment and give people a chance to do what they're already doing. And so if we could get up and stretch and do a little, because we're about to talk about love, sex, and relationships. So let's get up and DJ, I queued you up before. Oh, he put this is the upbeat jazz in the elevator. Okay. Love, sex, and relationships. Last panel. All right. Thank you for your participation. We love the energy. We have three, of course, fabulous, brilliant women here. And so I just want to give you some space. We'll begin with Dr. Givens. Why don't we start with you and then move to Sarah and Nicole Jones and then just move down. Say who you are, your role, and what you do in the cancer community.
Well, I'm Dr. April Givens. I'm a licensed psychotherapist. I am here representing Ora Lee Smith Cancer Research Foundation. You can check us out at oralee.org. Dr. Green is a physicist, the founder of the organization. She has created a laser technology using nanoparticles to help eliminate cancer cells. So we're in the process of FDA approval to go to human clinical trials. So that's something that our organization is working toward. In my private practice, I'm a licensed psychotherapist where I see individual patients, cancer patients as well. I do trauma therapy as well as hypnotherapy, and I'm also a herbal medicine specialist.
Thank you so much, Sarah.
My name is Sarah Contreras. I am a stand-up comedian. I have performed all over the world, and I'm also a speech therapist. I have a master's in speech pathology. I just retired after 40 years working with our special needs populations. I am a project girl from Brooklyn, but now I'm a Puerto Rican. That's a Puerto Rican with equity. And I was diagnosed with breast cancer January of 23. So I am very recently on the other side with my reconstruction, and I'm going to talk about my responses and the feeling of luck, that whole notion of luck. That's what I want to talk about today.
Well, I'm Nicole Jones. I'm a trichologist. What is trichology? It's analyzing hair loss from the endocrine system. I am the founder of Beyond Cranial Beauty, and what I do, I provide comfort, confidence, and beauty through and after such ordeal.
I appreciate hearing the variety. So again, thinking about the identities that we have, there are people who are providing perspectives around different identities. And some of the ways in which identities absorb love. This panel is on love, sex, and relationship. So love. There are different aspects of love. Self-love, parent-child love, communal love. Before we move into different kinds of relationships and sex, just around love, the body, the new body, and releasing anything that may happen with someone's journey or living with cancer. What can you say, encourage, affirm around what love can look like when someone is in their journey?
I'm going to start.
Yeah.
For me, part of my journey was understanding that I'm not just a cancer patient. That's not what's defining me. And being fortunate enough to be in a situation with a loving partner who isn't just concerned with my physicalness. The physicality was important, but we have been together long enough to know that I'm so much more than just what he sees. So I was very fortunate that I had a partner who I knew despite the fact that my breasts were torn open and my nipples were removed, that was not going to be something that was going to make him love me any less. The bigger issue I had with my relationships were, I have a difficult relationship with my son, so that was the hardest part of getting through the journey, because I had that on top of the journey of, dealing with my cancer diagnosis. But I was very, very fortunate. I was very lucky that I have a very strong family that backed me up in every sense, and I had a partner who was not grossed out and wasn't turned off to the drains coming out of my sides and having to clean it all up, and he was the one that got me through it. And that's what I was saying about feeling lucky that I was in that situation. That word kept coming up. You're lucky it's an early diagnosis. You're lucky you caught it after 60. But I'm sitting there going, but I got cancer. So, and he would say stuff to me like, well, despite, except for the cancer, you're a very healthy woman. So that was always a weird sort of dichotomy that was going on, and I didn't understand it. But as far as love, I love myself a lot. So I was able to tackle it, and with grace. I ate a lot of pasta. I ate a lot of chocolate. So I'm paying for that now, but I was very fortunate to have someone that I knew was going to be able to get me through it. And I think that's the most important part, is finding someone that you can count on, whether it's a partner, whether it's a best friend, whether it's a sister, because you do need that help. You're not going to be able to do it by yourself. You are going to need the support of someone who's going to catch you every time you want to fall.
Thank you, Sarah.
So I want to speak from the point of self-love. So I know I talk a lot about self-love when it comes to, cancer diagnosis and when you first find out. So with having family members, close friends, patients of mine who have been diagnosed with cancer, I know first finding out is devastating. People generally break down. So you have to kind of get your mind around the process of, this is a diagnosis that I have, so now what? So being able to understand the mental ramifications of that at first. Turning to yourself, going within, looking in yourself in the mirror, looking at the new person, the new body, encouraging yourself, telling yourself, I'm a big proponent of positive affirmations, telling yourself you are beautiful, you will get through this, constantly self-encouragement, and surrounding yourself with people that are encouraging you, eliminating all negativity from your life, all negative people from your life. I had a close friend to tell me that when she first found out that she didn't tell all of her family, she only told her immediate family, and she told me and one other friend. And what got her through it was the consistent positiveness that she received from me and her close friends. I would consistently send her positive messages, positive quotes, positive affirmations, positive videos. So that's one thing to tap into, being positive within yourself. You don't have room to be negative. You have to continue to be optimistic on the journey.
One of the things that I do to reinforce love is always my greeting, hello beautiful. And that in itself, it sets the tone, right? That someone else is identifying me as beautiful even with what I'm going through. So my part is to ensure that you have that confidence, that you feel beautiful. Bringing back all of that you possibly have let go and reminding you that you are still there. You are still there. You are still beautiful. You haven't changed. You are you, right? So whether it's, giving you a piece and just listening to you and being there while you talk and you vent, and being that shoulder while I'm providing that, new piece to help to give you that confidence. This is another way that we can pour into those who are going through, right? By giving them that love. What we say matters, and it definitely helps with the confidence and the security of feeling love.
It is so affirming to hear this. I can recall different facets of what you all are saying. I remember being on a specific drug, and it changed part of my face. Like there was a shadow, like a grayish shadow after effect. And I remember saying to the social worker how ugly I felt. And she did exactly what you did, Dr. Gibbons. And she would say, Ife, don't talk about my friend like that. But she was talking about me. It was so affirming, like what you said. She was saying exactly what you said, Joe. That when I didn't have the self-love in those weeks, that there were people who understood that that identity, that I was deserving of of those deposits being seated in me at that time. I felt that. And to be able to know that I could rely on these messages from those who are part of my care team, it means so much.
She got you through.
She got me through because I was really thinking, this mirror is presenting somebody ugly. Not thinking about the drug, not thinking about the healing, not thinking about it was a low, low point. And when you have women like you, practitioners like you, people like you, health practitioners, navigators, activists, who are able to step in and provide love, it matters deeply. And I can recall when one of my family members said, do they care? They sound like they care about you. And I remember saying, no, they love me. And it wasn't like a performance. It was that they meant it. And so when you're able to share, hello, beautiful.
That's such an easy word to say. It's just it's there, right?
But if someone doesn't, I mean, part of what we have been talking about this whole day is that when somebody already comes into the space and doesn't see you like that, and you are worthy of those messages, if they don't see you like that, even though it's easy for us to say, when somebody doesn't see it, they may just think, here, let's just move through the clinical plan that we have today. So today we're going to talk about love, okay? Health and hygiene, medicine, like, no, hello, beautiful. Right? That extra, to be able to know that I have done my own work as a practitioner to remove the biases, to remove the prejudices, to be able to do my own identity work, to know that I can say something that is so easy and deserving to hear.
And it's so important to find a practitioner that understands your journey, right? One that you can connect with. So important. It's nothing to say, well, you don't work for me, and find someone else, because you do need that support on the journey.
I was very lucky. I had a great team at Englewood Hospital. Yay! Englewood Hospital, New Jersey. Englewood. A lot of people said to me, you're not going to go to MSK? I said, you know what? I already feel confident. I did the research. I did. I wanted to make sure what her history was, what her success rate, what people were saying about her. So I was diligent about making sure that my team was someone that I could count on, that I could depend on, because I was putting my body in their hands. And it was just so shocking after years of having healthy mammograms. I got a mammogram every year as a Christmas gift to myself. I did it right before the end of the year, before the deductible started to kick in again. You know, when you're at the end of the deductible, you get an implant, you get everything done right before the end of the year. Get it all done. And so diligently every year, and when I got that notice that there was something wrong, I was like, oh please. You're thinking, I'm so old, what am I going to get now, right? And you get this shocking news that you have cancer. But again, that whole notion of, well, but it's early, so you're lucky, and it's early, and it's, you're over 60. Oh, you're over 60, and this is when you should get it. If you're going to get cancer, get it now. And I remember him saying, somebody said it to me, it wasn't my doctor, somebody else said it to me, and I was like, well, I'm sick. How do you say that I'm lucky if I'm sick? I'm still going to live with the fear of always having cancer again, of always it coming back and so on. So, you have to do the work and be prepared and get your mammograms. Get your mammograms. Get your mammograms.
Thank you for sharing this. Okay, we're going to talk about sex. Yeah. Mm-hmm. This is, thank you, right? She was like, get to part 2. I've been waiting. We have a couple of minutes for this. This is a conference within itself. There are several opportunities. I know that I heard phenomenal talk at the AONN conference in Atlanta, and the nurse navigators touched on it wonderfully. So we're gonna dive into it. There'll be a couple of layered areas. So let me look at my notes because I wrote a lot down. Oh no, that was personal. Let me just. Okay. There are changes. Body shaming, body acceptance, breast and vaginal changes, transitions, what works, what doesn't work. I'm really just trying to leave it as open as possible. I know we, talked about this area, but what are some things that you have experienced, Dr. Gibbons, I'll begin with you again, when you are working with your patients around just talking about during treatment or post-treatment around sex?
Oh, sex has to be reinvented when you have a cancer diagnosis. So whatever you did before may not work because your body is going through all these different changes. Your libido may not just be there anymore, like all these different things, pain, all these things, not in the mood. So sometimes, you just have to reinvent the wheel. So talking to your partner, communicating. I think that's so important. So many couples are scared to communicate with each other, especially when there is an illness or a diagnosis. So being able to talk to your partner and find out what their needs are as well as what your needs are and how you can accommodate. Sometimes it may not be sex, it may be hand holding, it may be cuddling, it may be intimate touch. So different things like that you have to incorporate now because this is a new norm.
Yeah, well, I definitely did not feel sexy without nipples. And once they removed it, I had to have all of my breast tissue removed, but I was able to save my skin because I was lucky and there was no cancer in the skin and the lymph nodes. So I had to adjust to being nippleless, and my partner, my domestic partner / husband, I don't want to get married again, ever again, God forbid. The divorce was brutal, oh hell no. So he was like, well, gee, you don't feel that. And I go, yeah, but you know what? The inside of my elbows are really sensitive. And the back of my ears, like it's not just tits and ass, bro. There's more going on here. Stroke my hair. Do something, like discover the rest of my body. That's about the greatest thing about cancer, in the sense that now he's discovered that there are other ways to please me and there are other ways to get me aroused that don't just involve what he always seemed to think were the only parts of me that were working. And now the doctors want me to have tattoos put on, and I kind of like my breasts now. I'm okay with them the way that they are now. The nipples are interesting, they're two-dimensional, but I'm okay. I don't feel like that's gonna change anything, and we're really active. It's so good. It's so good. Maybe better than ever.
So, visiting the salon, many of you depend on your stylist as your therapist as well, right? So we tend, because I'm also a cosmetologist, we hear everything, right? So one of the things that I encourage a lot of patients that I see or clients that I see is to communicate, right? We hear that, husbands don't understand, they're not listening, and I get that. And if I'm close to, which I'm close to a lot of my clients, and the husbands would come in, we would encourage them to listen, have a conversation and to listen. If, she feels that she's not beautiful enough to get aroused based on her appearance, we discuss what things you can do to encourage yourself to feel like that. But it all boils down to communication.
Okay, so communication is around frequency, ability, duration, capacity, desire, tools, helpful. I'm trying to go slow so people are taking some notes. Frequency, duration, capacity, tools. So I have a cousin who is a female woman guru about the female body. She's a massage therapist, a doula. So she began to talk to me about lubrication, vaginal atrophy. And when I first found out about Cher, I remember like saying that. And I was like, I'm not sure what to use. And they were like, we're on your cousin's side. Start, work, use, practice, even when you don't want to. And so that's how I learned. So when you talk, Sarah, about, so let me set it up. What is inside a one-piece bathing suit is often thought of as the sexual parts. What is inside a one-piece bathing suit, right? Helpful? So when Sarah is talking about like the inside of my arm, my elbow, my neck, my ears, those are areas outside of the one-piece bathing suit. How can you provide some language specifically, I mean you did, but specifically around like, I used to relate to sex in this way. I used to be able to feel aroused in this way, and now I'm taking alternative routes. Let's explore this body together.
Except for the feet. The feet,
Except
no.
for the feet,
Ooh,
okay. For you, outside, and the flip-flops, no
Do
work.
not touch these feet.
What are some other ways in which you were able to courageously say that this is how I'm now learning to identify with this petal of my body?
Well, having gone through the whole, obviously the double mastectomy, then I had to have back grafting, and then I had to have reconstruction. So there were very long periods of recovery. And so my domestic Alex saw me just essentially a hot mess for 4 months at a time. So, almost a whole year of recovery. So I think that created a lot more awareness of the changes from what he was just visually, perceptually able to see, the fear, the pain, the listlessness, the sadness, all of it. And I think that kind of turned him into a more sensitive partner in that sense. I feel like that opened up another eye for him, and he was able to see me in another way, because he's always seen me as strong, I'm a fighter from the hood and whatever, but he saw me vulnerable, and I think that was an opportunity for him to grow as well. We grew together through that process, and so I think it opened up that eye, and it opened up another set of ears, where he was maybe not as defensive and not quick to react. He was more just listening, and that's that communication piece. He was responding more instead of reacting, and so he was receptive, and that's another part of communication, right? He had to want to hear it, and he had to want to change, and he had to want to see what the new needs were. So right after each of those phases, I remember, you get cleared, and then all of a sudden you have to face that first time. And it was a little uncomfortable the first couple of times. It was uncomfortable because I still felt unsure in this new body. I still felt like it wasn't mine. I still hadn't had ownership of it yet. It still felt foreign. This wasn't the one that I had worked for all my life. And now, because of this ugly little tumor in my body, everything is different. I put on weight. I wasn't as fit as I was. So I didn't feel as sexy as I could have, like I used to feel about myself. So it was like a two-prong. I had to get him on board, but I had to get myself on board as well, feeling comfortable to tell him, I'm ready. And then, and he didn't, and I was lucky, he didn't push. And I was very, very lucky. He said, take your time when you're ready, but hurry up. Let's go. So, I just...
We're going to talk about that. We're going to talk about the insensitivity that happens around sex and relationships. We'll get through this part.
It's a big one.
Yeah,
it's a big one, you know. But like I said, it's that luck piece that is still playing around in my head, because I've never considered myself a lucky person. You know, 22 was the year that I felt lucky. I got cast to open up for this band that I loved all my life, and it was the best year of my life, professionally as a comedian. And then at the end of it, boom! I find out I have cancer. So it was like, oh yeah, I'm lucky, let's pull that rug out from under you yet again. You know, it's like, not luck, I've worked my ass off. So what I have is, I have from work, not from luck. You know, so it just,
Thank you, Sarah, for sharing that. Thank you so much. Dr. Gibbons, and I don't want to say advice, but sometimes it really is just role play. Sometimes it's just helping people to figure out what the language, how to articulate that this is where I'm at right now, and how can I don't want to say elicit, but part of my self-love is saying that this is what I need, and this is what I deserve. What would you do in your work with your clients?
Yeah, absolutely. The same thing you're saying, just communicate. I think it's important. I keep stressing the word communicate, because so many couples don't communicate. I do couples therapy, and it's just, it's amazing. So many people have been married 25 years, and they come into therapy, and it's like, you know, it's taboo. And so they're learning so much about each other. So being able to communicate your needs and your wants to your partner. You could be with someone 15, 20, 30 years and still not know everything it is to know about that person. So being able to ask them what it is that they're looking for, how can you support them as well as them supporting you. Tell them as a cancer patient or survivor, like what it is that you need from them, because they don't know. And so you don't want to automatically assume that because this person is your person, that they have to read your mind and they should know how you feel. So you want to be able to tell them, like, this is how I feel. This is what I need. This is what I need from you. So this is what I would like you to do.
I appreciate that. And I am learning too. I'm learning right now what I need right now. I don't know how it'll be. I mean, that was very good. You know, Sarah, we talked about the phases of surgery, the phases of treatment. Like, I'm at this point right now. And so I am learning and exploring, and I too am trying to find the language to be able to articulate how intimacy is a starting point for me and not actual sex. How intimacy is. There was one participant in a support group who said that they were so comfortable with the hand holding and strolls in the park and exploring areas outside of the bathing suit. And the fear, the hesitation, the avoidance to actually move to the inside of the one-piece bathing suit, and how that was a transition, and the communication, how to be able to clarify, I might be ready, but I might not, and the trepidation that they have it. What are some of the things that you may have heard in the beauty parlor? Because the beauty parlors, beauty salon, y'all know everything.
We do, right? We hear everything. It's always the complaint of, you know, he doesn't understand. He doesn't understand, he doesn't get it. He's not listening. He's not listening. Are you talking? Are you speaking? Are you sharing? What are you sharing? Is it a case where, because honestly, he wouldn't get it because he's not going through it, right? And if it's a case where we are not sharing how we feel and commanding what we need, it's hard to just expect that. So again, this is my conversation a lot with my clients. Share. Just like you're sharing with me, share with him. You know, he wants the hair. You know, she wants the hair. They want the hair. They want to hair. So just share.
I really appreciate that, and I appreciate you expanding that the conversations are with multiple kinds of partners, right? She, him, they. And so they are deserving to be able to know, and you are deserving to take the space to be able to say that this is where I'm at. First step, day one. Exploration, desire, capacity, helping aids, tools, right? I just recently learned that there's some vaginal lubrication ointments that also help with hair as well. I'm gonna be slathering this stuff everywhere.
That's all right.
I need that. But I know, that's what I said. But it's because I was talking about it with other women, and they shared with me, right? So there are benefits to be able to, do you remember that, Carol, when they said that, yeah, these things are working, I am about to get a supply cabinet. How do I move through learning if I'm not sharing, if I'm not hearing, if you're not telling, right? And not just to those who I know I can talk to, but when it is very difficult to be able to say, I am different, right? We're joking around, but we're also very serious. I'm very serious to be able to learn. I am learning. I appreciate that.
I remember telling my husband at one point, I don't understand why you would want to touch me. I look like an ogre. I said that. I said that about myself. I was looking in the mirror and I said, I look like an ogre.
Like me, self-loathing, self-hate, that's where it comes in. How do we interrupt that? Self-loathing. We're interrupting that. Yeah.
But, you know, then I had to understand it was his time. Actually, you know what? I forgot to mention, my husband also has bladder cancer. So he was diagnosed 2 years before I was diagnosed. But thank goodness he's on a great path now. But it was his first time dealing with someone who had a diagnosis of breast cancer. So it's about, you know, taking his feelings in as well and being able to use that as an opportunity, like, what are your needs, what are mine? Mine are more important right now, but I still need to know what yours are so that we can, as a team, tackle this together, because that's really what it is. It's teamwork. It sounds, you know, cliche-ish, but it really is. If you don't have that team behind you, even with sex, love, and relationship, you know, it's not gonna happen.
Wonderful. Okay, we're gonna transition into a fuller balcony lens view of relationships, right? And there are certain ways that many people living, whatever their relationship is with cancer, as a caregiver, as a patient, as a survivor, someone during treatment, post-treatment, someone who is witnessing how difficult it is to bear witness at times, right? As a healthcare provider or a family member. Just trying to set the stage of the various kinds of relationships. When we think about managing, let's start with the patient themselves. When we are working with patients themselves, what is it like? What is it like? How would you support? How would you supportively guide a patient managing fear, isolation, or terror? Fear, isolation, or terror that they are experiencing?
I think the first thing I would definitely recommend for them to do is to journal. You know, journaling is amazing when it comes to just really letting out those feelings. Sometimes you don't have that person that you want to share those inner thoughts to. So I think it's important to always keep a little notebook and a pen with you and write down those fears, those thoughts, all of those things that are coming up. And then, I mean, find a support group as well as a therapist to be able to talk to and maybe talk to the therapist about some of the things that you're journaling. A trusted friend, your husband or wife or, you know, whoever, to be able to share some of those feelings that you have and being able to navigate that. I have a format that I give my patients. So with the journaling format, it is, what is the situation? So that's the first step, like what the situation is. The second step is, what are my thoughts surrounding this situation? The third step is, what are my feelings and my emotions about this situation? And then the fourth step is, what is my plan of action based on my feelings, my thoughts and emotions about this particular situation? Because it's okay to have the feelings and have the fear and cry and grieve and all these things, but you don't want to stay there. So what's your plan of action? What are you going to do? What steps can you take now to begin to move forward.
Getting unstuck.
Yes.
It's hard. It's hard. But I think that you having the fourth step is very helpful. A plan of action, compassion and accountability. Thank you. Mm-hmm.
So I believe in community. That's one of the things that I preach. I talk about community. And within community, especially in my community, I do have friends who are oncologists. I do have friends who are therapists. I do have friends who's an OBGYN. And within that community, as I am with my clients, they are also accessible to them, right? So when they're going through these different emotions, they're able to reach out, right? And to have that comfort in knowing that after hours I could call Dr. Thompson, who's an OBGYN, or Monique Brown, Hartley Brown, who's a hematologic oncologist, but she's an oncologist, and to help or walk them through what they're going through, or my cousin who's a psychotherapist, right? And be there for them. So that in itself, it helps with the fear, with the reclaiming self process. But community is very important, extremely important for support as well.
You gotta go. I'm gonna have another season attack, so you gotta go, Sarah.
Well, I mean, it's funny because when I was going through all 3 surgeries, but especially in the beginning with the mastectomy, which is the double, I chose to remove a healthy breast. I wrote, but it was more of, I'm always thinking in terms of stories. I love stories, I love creating stories. So I created the character, and I'm turning this into either a screenplay or a theater play, so that I can take all those feelings that I had and all that fear and the terror and all of it, because terror is really the biggest word. I was so damn scared. I was scared to the point of paralysis, where I just wanted to lay in bed and not move, because I just felt like maybe that'll help everything heal faster. So I became extremely reclusive. I didn't, there were people in the comedy world that didn't even know I had cancer, because I didn't announce it. I kept fighting the urge to go to Dr. Google to answer all my questions. And that was that. So for me, I tried journaling, and I don't know what it was. I had such a block being able to express what I was feeling, because I don't think I really even understood. I was so consumed with fear. And it was unfounded, because the doctors were telling me that I would be okay. But it's also cultural. My family, everybody was sick. My parents' generation, they were all sick in their 40s, but nobody talked about it. And they just kind of hid it, and you didn't talk about it. And I think that one of the speakers before talked about how it was almost like a failing if you got cancer. Like that was something that you didn't talk about. You just didn't mention it. It was after I got sick that I found out from calling my cousins to get my history how many of my aunts had breast cancer or had cancer in other parts of their body. So it was this cultural, and I think, despite the fact that I know better, I still, there's the heart and there's the brain. And I know the brain was giving me all of the data and the facts, and this is what you should be relying on. But my heart was just scared. And so, for me, it was just turning inward and being still. Like for me, that was a big life change. I was always this sort of maniacal type of personality that was doing 10 things at once. I never knew how to relax. And that was the opportunity for me to just be still and just sit in it and wait until they told me that I could get on with my life.
I appreciate that. I think that the 3 of you, I know that the 3 of you, to be in community, for some to be in prayer, to be in nature, to be in journal, sometimes to dictate to a recording if you're not writing it down, to know that there are cultural parts of ourselves that offer pathways to be able to get unstuck, okay? We have a few minutes for some questions. I've looked at these faces. Come up to, that's right. Come up to the mic. A question on love, sex, and relationships.
Come on.
Well, I really appreciate all of the conversation around love. I would be remiss if we didn't mentioned masturbation and self-love and the importance of that.
And that was our answer right there.
Hello.
Thank you, Zarek. That was absolutely appropriate as what we're talking about, right? Showing up in the fullness of our truth. Thank you for that. Yes.
Hi. First of all, thank you so much for sharing your expertise, sharing your experience. It's so important because these topics of sex and sometimes even cancer, like Sarah said, they're taboo conversations in some circles and cultures. And so I would ask, what resources would you be able to provide someone when they don't know how to start the conversation, when they don't know how to communicate their wants, their capacity, or desire? Are there resources that we could provide?
I would say more, I think it's important to be able to advocate for yourself, but like you stated, some people are passive and just can't do that. So if you have a loved one or a family member, a friend that's close to you that you can communicate your concerns to and they can be your advocate, I think that's important. Also, support groups. A lot of people go through this alone. So I know here at Share Cancer Support, there's a support group and you're starting the peer-to-peer group. I think that's so important for people to be able to get into those groups. Seek out help, seek out, resources. Stay away from Google. Like she said, Google will have you thinking that it's the worst. So stay away from Google. If you want to do research, do peer-reviewed studies and journals. Look up that. You could Google peer-reviewed studies on different types of cancer. Look at those journals. That's more accurate than just Google within itself.
That's a good point. That's what I was saying before about researching and the team and making sure that you know the background and you know the success rate. And, doctors are wonderful, but there's a couple of bad doctors here and there. So just make sure that you do that research and you're diligent about it.
I think that one of the things that I want to be able to lift up is what Nicole Jones talked about, cultivating the language. I mean, even when they are in the beauty salon for the cranial beauty work that you do with on heads, on all kinds of heads, the practice, learning the language to be able to have the practice, to be able to, and practice, this is the practice before you can actually explore how to be able to say what you need to be able to say to a mate, to a spouse, to a friend in relationship. At Share, a lot of our support groups and the work that we're doing together is creating effective dialogue skills around relating and sharing, right? So if someone is practicing or coming to the support group and learning how to say, I was socialized to think this. I'm unlearning this. I can relate to what you're saying. It is new for me. It's so much easier for me to talk to Nicole. It's so much easier for me to be able to call Sarah on the phone. It's so fluid when I am speaking with Dr. Gibbons. I feel sweaty, I feel anxious, ambivalent when I am talking to you, right? Because I am doing this, I want to do this with you, or I no longer want to do this. I am learning, right? And so a part of our support groups is providing the language exactly on what the three of you are talking about, because it is so easy and fluid to do it with you three, right? But to say to somebody, I'm outside of the bathing suit right now, or I'm not able to manage this tumultuous relationship that we may have with our children, our family, our own parents, and try to manage this newness of journey during treatment, post-treatment. It is very difficult, right? But developing that and practicing. Yes, Christine.
Hi, thank you, panelists. Great panel. There's an amazing sex therapist called Suzanne Iosenta, and she talks about the emphasis on willingness as the key to desire. And she also talks about creating a sexual menu, right? So like instead of having the menu out and you're thinking about what kind of appetizer you're gonna have, what kind of pasta you're gonna have, what kind of entree you're gonna have, you have this menu. You can say, you know what, I feel like doing this tonight, or or I feel like doing this. We don't have to go there. We don't have to have the main course. Maybe we could just have some appetizers tonight.
Oh, I love that. And we have a printer in the back if you want to pull up that menu and print it out for the entire audience.
Also, when you think about willingness, right?
Yeah.
When you think about body image, and Sarah, when you were talking about how you saw yourself, right? Could you be willing? Is there any willingness to see yourself any different in that moment? So willingness can open up a whole new door in many areas, sexuality and body image and any area of your life.
That is very helpful, Christina. We had a conversation before, and I remember when I listened to a therapist and talked about when she said, when are you ready to tell someone on a date that you have a missing body part? I never thought of the breast as a missing body part. I think of it as fat transfer built from Haagen-Dazs during the pandemic. Do you understand? So diversity of perspective, diversity of being able to receive information from my therapist to be able to understand that somebody may ask on a date about the breast with what they may think of it as a missing body part. So I was able to practice, not feel offended, and I'm thinking, this is beautiful. Are you kidding me? What? The surgery? This is a fat Haagen-Dazs. Vanilla Swiss almond all right here.
Girl, come on now.
Helpful, but perspective, the diversity of, this is experience, the thoughts, to thought partner, to practice. So I was able to practice with her so that I could be able to be prepared on a date, right? The willingness to be able to talk about something that somebody else may call it a missing body part, right? Just to be engaged.
Well, I started to feel a little bit like my old self, and for me, the pivotal point was putting on some high heels.
Hey.
As soon as I could get back into my high heels, for me, that was what made me feel sexy. Everybody has what makes them feel sexy. For me, it was high heels. And the day that I put them on, I remember I walked around with nothing else on.
Hey.
There you
I
go.
just walked around with my nibbleless breasts.
I love it.
And my high heels, and I said, you know what, you're the prettiest Olga I've seen today, honey.
There you go, mama.
This Olga is hot.
I love it. But how that could help someone, that's fine. How that could help someone hearing that, right?
Yeah.
Perspective, hearing that this is an option for me to be able to do. By yourself in your own mirror, right? To be able to interrupt feeling ugly or Olga, right? Now that has changed. Thank you so much.